Hi, this is Brian Kim, and this is episode 4 in the Surgical Instrument Review Series, and we'll be reviewing Epsilon EP-68K, the Singer-Koch Capsule Polisher. And this instrument is used to clean the lens epithelial cells under the anterior capsule, but it is also pretty versatile. It helps clean and polish and pull up stubborn cortex in the subincisional area. And these are going to be all big pupil cases so that you can see the sweep in action. So after cortical cleanup, you can see I'm filling the capsular bag with some viscoelastic. This is the end that's going to go through the right incision to sweep on the left side. You can see this is made of titanium. And you can see that the handle is round and textured. And then this is the other side to sweep from the left incision to sweep on the right side. And you can see there's a tapered top surface, so it kind of tapers off. It's not sharp per se, but because of that tapering on the anterior surface there on the paddle, you can see you get a really nice cleaning surface to polish the lens epithelial cell. So this is the other side. I switched hands, and this goes through the left side incision, polishing on the right side. You can see the angle. The angle is really acute, and which provides a lot of leverage and better ergonomics to be able to reach the subincisional area. So I use that same instrument to hold the eye when I put the lens in, and this is the end of the case. So you can see how nice and clean the anterior capsule is underneath the rhexis edge. Of course, you're not polishing deep into the capsular fornix, but that's not where you want to clean. You want to clean right where that interface is, where the optic overlaps the rhexis. So this is the next case. I'm filling the bag with cohesive viscoelastic. And you can see the instrument in high mag. This is the side that goes through the right side incision to sweep the left side. You can see the top of the paddle has a tapered, smooth edge. It's really good at moving the lens epithelial cells. This is the part that goes to the left side incision, sweeping on the right side, and it's the same thing. Again, the angle is angled in such a way that it's easy to maneuver and polish in the subincisional space, as well as the contra-incisional area of the capsule. So you can see it's able to polish across the contra-incisional area as well as the subincisional space because of the angle. It's angled towards you, and because of that, you're able to get a really nice polishing of the subincisional anterior capsule edge. And after I put the lens, as you can see, we're going to clean up at the end. And look how nice the interface is. The capsule is really pristine. There's no discernible lens epithelial cells seen at the optic level there. And this is the next case. Again, I used large pupils for these cases, just an example to illustrate how the polishing goes. Again, it's polishing into the subincisional area. You can see how clean the lens epithelial cells are coming off. Again, because of that sharper edge on the top of the surface of the paddle, it's able to really sweep really nicely. And because it has a little bit of a sharper edge, it's able to grip underneath the anterior capsule and really more effectively polish the lens epithelial cells. And I like the sweep because it's really very thin profile. It's easy to access 360 degrees. You're able to access the subincisional area, which is always the most challenging. And just to be clear here, I always polish with my polymer tip with the INA handpiece. And so that's why you can see contra-incisional to the main incision, it's fairly clean. And so really I'm working in the subincisional area. You can see in this case, as I'm polishing, some of that cortex comes out. And so sometimes there could be stubborn cortex in the subincisional space. And so the sweeper works quite well, not only to remove the lens epithelial cells, but to remove some of that stubborn cortex as well. Again, that sharp edge is really nice. It's very safe. I haven't really cause any complications in the process of sweeping as far as damaging the capsule or bag. And you can see again at the end of the case, the capsule is really nice and clean. And this is another example. Again, the thin profile really gets through a nice 1 mm paracentesis incision, and I'm able to, again, polish contra-incisionally, but also in that sub-incisional area because of the angle of the sweeper. And I'm able to do that on both sides very comfortably and very confidently. And again, the maneuvering is very easy. Again, you can see here, there's some more cortex I was able to get out using the paddle. And so this is really a really easy, nice way to clean the lens epithelial cells. There's three major reasons why I like polishing. One, I do think it reduces the risk for posterior capsule opacification. Certainly, I feel like it helps reduce the risk for capsule contraction. And more importantly, I do think it helps make lens exchange much easier. And nowadays, when you're dealing with refractive cataract surgery, you want to be able to make easier the chances of having to do a lens exchange. And I feel like by polishing, it does make it easier to remove lenses that you want to get out and replace. So again, you can see I'm polishing pretty vigorously. Again, the technique is quite easy. The thin profile of the instrument goes through a small incision, and you're able to polish really nicely into that subincisional area. Again, I always go back and use the polymer tip, the INA handpiece, to finish off any polishing, but in that subincisional area, it's not as easy. Of course, you can do bimanual IA, of course, but I don't do that technique. I like to do coaxial INA. And so for me, this really works quite well using this capsule polisher. I always use the Singer sweep, the first generation Singer sweep, and I noticed that the sweeping surface was a little bit blunt, and I just felt like it didn't work as well. And so with this iteration, this is kind of the newest iteration, and Dr. Koch obviously added some of his input. I really think it's a fantastic modification to the original Singer. Again, you can see in this case, there's a lot of cortex that came out in the subincisional area. And again, because of that kind of more sharp edge, it's able to grip the capsule and really more cleanly polish off the lens epithelial cells off the anterior capsule surface. So this is a really great instrument. This is the one that I'm really using now on a regular basis. I have abandoned that first generation sweep that I used. And really for me, as far as efficiency and allowing me to do the things that I want to do without being too cumbersome, this is really to me the best instrument for now. Of course, I'm always looking for better instruments, but considering all of my options thus far, I really do like this particular sweep instrument to help me polish lens epithelial cells and to go after subincisional cortex. So I hope this was helpful to you, and I thank you for your attention.